Let me start by refreshing what I know is your memory about our discussion over the last couple of years at Wichita State University about our unique mission in Kansas as an urban serving research institution, the only one in Kansas and one of 30 or 40 major urban institutions in the country. We're interested in programs that sustain communities, that support education, P through university, graduate education, that develop human capital, workforce, and that focus on human health and health in communities. And that's an area both of you are very actively involved in. And so, Greg, tell us a little bit about what you do, maybe inside that mission.
As the director of the Center for Community Support and Research at Wichita State, really what you just talked about is really our life, in that we very much focus on the health broadly defined people in Wichita and the whole state. And we do that by really working with people in communities and building their leadership and their capacity, their social capital, as you mentioned, so that they can do as much of that work themselves. And we try to help guide them through the research process of collecting data and feeding that back to them, and then really actively having them be participants in that work.
Now, this idea of getting them to help themselves brings up the transition in the name of that unit from the, tell us about that.
Well,
that's caused a lot of confusion. But it's also, I think, a good transition.
It's a good transition, though. It's been a tough, it has caused some confusion because since the mid-'80s we were the Self-Help Network.
Self-Help Network.
Yeah. And we started out as a statewide clearinghouse and research center around self-help and support groups. And about 10 or 12 years ago, we continued to be asked by other kinds of organizations and by funders to work with nonprofits and coalitions. And so we broadened our mission to working with all kinds of organizations. And in the last year, we changed our name to Center for Community Support and Research to more actively reflect that, though we still do all the things we ever did with self-help groups.
So do you, when you go to a community or a part of a community, you're invited there, or somebody brokers an interaction that you have with that group, or how's that work?
We're almost always invited.
By the community?
By the community. And it may be indirectly at times, but usually it's directly. We have people reach out to us. Having the platform of Wichita State gives us a tremendous advantage in that they find out about us through word of mouth, usually from past people we've worked with, and they invite us in because they have something exciting they want to do, or maybe they've hit a barrier and they don't know quite how to get around it, or maybe they just want to expand and build their capacity to serve more people. And so we engage them, and we engage them where they're at and really work with them toward the goals that they want to achieve.
So a lot of this seems to turn on communication, and I know, Deborah, that you're the Kansas Health Foundation Distinguished Chair in Strategic Communication. What is strategic communication?
Well, it can be defined in a lot of different ways. For me, it's very similar to what Greg's talking about, going to communities, going to populations, finding out what their interests are, their issues, their concerns, and helping them develop strategies for effectively meeting those needs, addressing those concerns. And largely, communication is the mechanism both through which you get that information and help people solve, manage, and negotiate issues.
So give me an example.
In the fall, the Kansas Health Foundation partnered with my strategic communication class, a group of undergrad and grad students at Wichita State in the Elliott School of Communication. And they were trying to decide what they wanted their next direction to be. And so they just asked students, go out, do initiatives, tell us what are some things that we could consider as next phase initiatives for the organization. Who are the audiences we should try to appeal to? What kind of strategies would be useful in getting to them? What are the needs of different communities and populations? And so my students did that work and came up with 4 recommendations for the Kansas Health Foundation.
The partnership with the university is critical, and we're so fortunate to have a university really right in our backyard here in Wichita. Because, you know, it's at the foundation, a lot of decisions that we make or a lot of programs that we're doing or initiatives with various media campaigns, et cetera, you know, we need solid data to make informed decisions. And that's where, you know, having that great academic partnership with professors who have that research experience, who have the research skills to go out and collect data and see if items are making a difference or not, but also just to have the breadth of knowledge to know what's likely to be a success and what's not. So really before working on various projects or programs, one of the first steps is calling various professors, especially at Wichita State, to find out what can we do? What's available in this field? Is it an issue? What are some of the best possible scenarios to move forward?